If you're turning 65 soon, you've probably been wondering what all is covered by Medicare. I've been on employer coverage my whole life, and now I'm going to Medicare. Is it even going to work the same? Is it going to cover the same? Is it going to cover the same things? Listen, we kind of know what Medicare covers, but what we need to understand even more is what Medicare does not cover. And that's what I'm going to talk about in these next few moments, is what does Medicare not cover? I want to say this, nothing replaces talking to an agent. So before you get into this video, after you get in this video, whatever, follow the information in the description of the video below. That way you can talk to one of our agents and they will tell you exactly what Medicare is going to cover for you, what it's not going to cover, and then put you in a situation where you will be best covered for you and your family. Please reach out today. So what does Medicare not cover? Well, first things first, I want to talk about what Medicare does cover just for a brief second. Medicare is going to cover hospital and medical. That's part A and B of Medicare. A is hospital, B is medical. And those two coverages, or those two Medicare parts, are going to cover hospital and medical. And they're going to cover them pretty efficiently. I'm not going to go into the details of how it covers, but there are certainly some gaps there. And it will cover those things. And then traditionally, you'll have some things like hospice care in the event that you need it. There is some skilled nursing coverage if you need that. So there's lots of things that Medicare does take care of. If you have chemotherapy, guess what? Medicare will cover it, but not fully. That's the thing that's important for you to understand. So the first part that I want you to understand that Medicare does not cover are your out-of-pocket costs. Let's talk about what those look like. First thing you need to understand is that Medicare does have an 80-20 coinsurance on medical. What does that mean? Well, that means that I have to pay 20% of all my out-of-pocket costs for medical type services, outpatient services, and that is uncapped. That means it could be completely and totally unlimited. I could spend $1 million in a year technically with that structure. And there's lots of ways that we fill that gap in. I'll get to that in a moment. But I do have an 80-20 coinsurance. Next, I have hospital copays. Those can get up to $400 a day and then $800 a day. Actually, $800 plus dollars a day that I'm spending. And then eventually that turns into 100% out of my own pocket. It's not even a copay anymore. And just like the medical side of Medicare, hospital is also uncapped, meaning technically I could spend $1 million a year there too. So I definitely have some out-of-pocket costs associated with Medicare that I need to be concerned with. Next, I have deductibles. I have deductibles for both parts of Medicare. Both parts of Medicare. I have a $283 annual deductible on Part B, and then I have an over $1,700 deductible on Part A. That is every benefit period. So I need to understand that I have 80-20 coinsurance, hospital copays, and deductibles. And then I also have something called excess charges. Excess charges. And these excess charges are the amount that a provider can charge over an approved amount for Medicare, and that's 15%, which is, guess what, also uncapped. That's something that I could really be in trouble with. Now, the good news is, when it comes to these out-of-pocket costs for medical and hospital, we can get you a Medicare supplement that would fill in the gaps, and it would actually take care of, a Plan G, for example, would take care of this expense, and this expense. It would also take care of your hospital deductible, but you would still be responsible for your medical deductible of $283 a year. But you can see that your costs become much more manageable, and we can predict them a lot better with that coverage in place. But Medicare does not cover those gaps. You would have to get additional coverage for it. Medicare is not going to cover it 100%. Next, I have drugs. Medicare is not going to cover prescriptions. It's not going to cover my drugs. I would have to purchase a Part D plan. We call that PDP. That stands for Part D plan, a prescription drug plan is what that's going to stand for. And this is going to be a process that the agent would go through, put your medicines in a tool, and we would find the plan that's going to have the formulary that fits your prescription list that you're using. And so we have to get you a Part D plan, a prescription drug plan. And that is going to take care of the cost of your drugs. Now, one hidden out-of-pocket cost here that's not covered by Medicare is you do have a $2,100 max out of pocket on those drugs. So even if I get drug coverage, first of all, if I don't have drug coverage, if I don't buy a prescription drug plan, my cost of medications would be completely out of my pocket. Even if I do buy a prescription drug plan, now I still have a $2,100 max out of pocket that I would need to get covered in emergency situations. And we like to use things like cancer policies or heart attack and stroke policies for these crazy situations where you're diagnosed with a critical illness to take care of those costs and eliminate that for you as well for sometimes up to 5 years, which is very, very beneficial. But Medicare does not cover drugs. And then Medicare is not going to cover what I call extra benefits. What do I mean by that? Well, let me list them for you. Medicare is not going to cover dental, vision, and hearing. That's something that a lot of people are not aware of. It's not going to cover any dental, vision, hearing. It will not cover nursing home. It will not cover home health aid or home health care to some degree. It'll cover home care a little bit, but it will not cover home health aid at all. Medicare is also not going to cover any of your burial. So if you want to have something for when you pass from this earth, when you do die, Medicare is not going to take care of that. So you need to understand that. Lots of things that Medicare is not going to take care of. Dental, vision, hearing, nursing home, home health care, home health aid, and your burial that you need to consider. Those are things that Medicare is not going to help with, even though you paid your taxes all your lives. But the good news is we have plenty of policies that we can throw into your package to take care of all these out-of-pocket gaps. Matter of fact, when we help a customer out and we give them the package that we see fit for them, we actually fill in all of these gaps so that the customer's out-of-pocket expenses are very minimal. That's the goal to all this, because you don't want to get on Medicare and then spend thousands of dollars that you weren't expecting to spend. You want to keep everything predictable, and that's what we're here to do. So what I want you to do is follow the information in the description of the video below so that you can talk to one of our agents today that can help you get set up with a package that's going to take care of you and your out-of-pocket expenses. Listen, Medicare is a very complicated journey, but the good news is we're a compass. Use it.